Hi, I'm Dr. Vishal Gupta. I'm a consultant pulmonologist at the Chest Care Clinic Kharghar in New Bombay, and I'm going to be talking to you about a condition called as interstitial lung disease. Interstitial lung diseases are a group of diseases where we have got a common theme of the lung which is shrinking or it has gone into fibrosis, and there is scarring inside the lung for reasons that are understood or sometimes not understood. The problem with this disease is that when someone is trying to breathe in air, the oxygen that we breathe in from the air doesn't go into the bloodstream and it gets unabsorbed by the body. And because of that, the patient has a lot of discomfort. What are the causes of interstitial lung disease? It can be because of smoking, and smoking is one of the most important factors that we'll try to correct in our patients. As soon as we get the history and we have diagnosed the patient with interstitial lung disease, we will counsel and we will enforce the fact that smoking has to be stopped because it helps control the primary condition. And also there are some smoking related ILDs like idiopathic pulmonary fibrosis, which are very progressive, which are dangerous, and even if smoking is stopped and the patient has not stopped it in time, the person will go into continuous fibrosis and will ultimately will succumb to this particular disease because of this diagnosis. The symptoms of the disease, interstitial lung disease, is basically there will be breathing difficulty, there will be a lot of coughing, and that cough is often very resistant to other treatments. Most of the time we get patients who are referred to us for breathing problems or having chest discomfort or incessant cough which is not getting better despite of medications from other doctors. And how do we diagnose this particular condition is when the patient has been having an x-ray and the x-ray shows us some kind of opacities in the lung which are not explainable by other major problems. We often have to make them walk around by doing a 6-minute walk test or a shuttle test. We see that the patient has low oxygen levels. We often have to put them through investigations like blood evaluations that can help us diagnose if there is any underlying condition that is causing this particular lung problem. We have to exclude other possibilities like infections, so sometimes we require sputum analysis, an endoscopy may be required, a bronchoscopy may have to be done. While treatment has to be decided, and if we do a CT scan, we can get better understanding about what kind of interstitial lung disease we are dealing with, and this gives us an exact answer as to how we have to go about treating the patient and what are the next problems that we can see in the future. It also gives us a very good idea about the quantitative problems or how much the problem is. So when we have a better understanding of that, we can start the patient on proper treatment. ECG and 2D echo are required to assess how much pulmonary hypertension is happening because of the ILD. So because of the interstitial lung disease, there is a pressure which comes on the heart, and this can be picked up by a test called 2D echo or the echocardiogram of the heart, where we can measure the arteries of the lungs, and that can help us understand more about the problems that a patient is going through. Pulmonary function test may have to be performed. Pulmonary function test may be a test which helps in understanding the lung volumes and the capacity. It also helps us understand it also helps us prove the diagnosis to the patient and establish that the patient's treatment is either working or it is not working, because this test can be performed readily before and after treatment to help us understand if the patient has been getting better on the treatment. Some of the cases of interstitial lung disease, we will have to perform more procedures like in endoscopy or bronchoscopy, especially to rule out infections like tuberculosis or other respiratory infections that come as complications or unexpected findings during a treatment for workup of interstitial lung disease. And sometimes we may have to perform a lung biopsy, which is quite rarely done these days. An open lung biopsy or an endoscopic cryo lung biopsy can be performed so that we can get a exact answer as to which kind of lung disease this is. Usually these are reserved for cases who are on the borderline and whose treatment may significantly change. If the right treatment is to be decided, we will need that lung biopsy because the tests are not able to conclusively give us a lot of answers. Treatment for the interstitial lung disease will depend upon the kind of interstitial lung disease that we have diagnosed and the severity of that interstitial lung disease. The lung damage from the interstitial lung disease is often irreversible and quite progressive. So the treatment will mainly focus around relieving the symptoms and improving the quality of life. Sometimes we can even try to slow the disease progression with medications like antifibrotics. Medications like corticosteroids can be used to reduce the inflammation that may happen during the flare up of the disease after some infections, or as a part of treatment for some of the interstitial lung disease, which will help prevent the onset of the fibrosis. Oxygen therapy is a very common treatment that we offer to our patients because it will help deliver the extra oxygen to the patient and make their breathing very easy. It will also help reduce the complications from low blood oxygen levels and the heart failure that can happen. Pulmonary rehabilitation is an essential tool for those patients who are having breathing difficulty because it helps improve the lung efficiency, it improves their physical endurance so they can move and they can do their activities every day to day, and it can offer emotional support as well. Some of the patients will need disease modifying drugs like for arthritis or for connective tissue disorders or for sarcoidosis, sometimes even for silicosis. And these patients can improve dramatically if the treatment is started early in the disease, if it is identified early and treated early, and smoking is not continued. All of these factors play a very, very important role in treatment for interstitial lung diseases. I am Dr. Vishal Gupta. I am a consultant pulmonologist here at Chestia Clinic, Kharghar, and we are regularly seeing such interstitial lung disease patients, and almost all of our patients are doing well when they have been started early on their treatment. Thank you and have a nice day. Thank you for watching this video, and do like and subscribe to this YouTube channel. If you are interested in some new videos, please give us your comments in the box below. Thank you.